Hi everyone. My name's Chris. I'm the head of sports science and strength and conditioning at Sydney FC. Big thank you to Aidan for inviting us here and organising another great webinar. And thanks for everyone who registered as well. It's always really nice to learn from others, and hopefully this presentation gives a snapshot into our team at Sydney FC. Our head physio Ibrahim, he'll present the bulk of the rehab component. But I thought I'd start with a quick overview of our setup and how we operate and link things together in the rehab and performance space. I'm really fortunate to work within our performance team, and on reflection, I believe that these are the handful of components as to why we work together so well, and the principles that kind of underpin what we do day to day, from being open-minded and having really strong values about what we believe is the right thing to do, to learning off each other and doing so in an environment that's constantly changing, and we have to be really adaptable to that. I think these things help to form a really challenging but positive performance team, and I think is a large factor to the success of how we work. Ibrahim and I have worked together the last few years, and we've bounced ideas off each other, and from my end as the S&C, things from pathology and objective-based criteria, early loading strategies, are things that he's taught me, but he's also taken on quite a lot from the sports science and strength and conditioning and how he integrates that into his rehab. And you'll see the great job he does later on in this presentation. We collaborate every day as a team to drive the best outcomes possible with the resources that we have. When it comes to drawing up the map of our return to play, we have a team doc, a high performance manager, Ibrahim as the head physio, myself in the strength and conditioning sports science role, and a club sports scientist. And we're in contact pretty much every day, and every contact that we have with each other plays a role in our rehab design. A really great example of this is if we know that we have a player that's looking to be reintegrated into training, and we have a tactical based possession drill in the coming week, we might modify the rules, the shape of the drill, the size of the drill, to try and include that player as safely as we can. Because we understand ultimately that rehab it's not a linear process, and we have to think about the constraints as they interfere and the opportunities as they present themselves. Our planning is backwards, and I mean that in the nicest possible way. Our ultimate goal is to have the end goal in mind. So we use individual player data on each position where possible to assist in the rehab process. We try to consider the demands of training, our expectations around that, our expectations around gameplay, and the style of play that we are implementing from our head coach, as well as our athletic development philosophy. And while we're doing all this, we have to consider factors that might not be in our control, such as travel, a congested schedule, international call-ups, or rotating, or in some cases not rotating the squad. Here's a really brief summary of what's happening in football. There's plenty of information out there, so I won't bore you with it. But ultimately, really good players perform more high intense actions. And our league in Australia is a little bit different to others. We play in the summer, so sometimes it can be really hot. We are fortunate enough to play in the Asian Champions League, so sometimes that involves international travel and then returning to Australia and playing another domestic game. And the style of gameplay in the A-League is a little more stretched. So it can be a lot more physical. And if you ask our foreign players or players who have played abroad, that can sometimes be a factor as to why the A-League is a little more difficult than playing elsewhere in the world. In a typical day, our athletes may be asked to perform any or all of these things. And the rehab design has to consider the expectations around the way that we train and include them where possible. Everything we do day to day links in with our athletic development philosophies, but ultimately we're really fortunate that we have quite a good level of autonomy from our head coach and coaching staff, meaning that we can implement whatever we feel is necessary based on our professional opinion and not being dictated to. Here's a quick video of some on-field considerations, something as simple as the warm-up. But we film everything that we do and it's profiled. So we have a lot of information about what each athlete needs to do. The warm-ups vary, pretty much every day, but we always include concepts of our athletic development philosophies here. And the rehab design needs to include elements of this so the athlete is prepared for what's expected of them when they return to training. Some of the things it might include plyometrics, like the linear hurdle hopping you saw earlier, some accel decel work, and sometimes here we've just got to chuck in something fun like a competitive change of direction drill. And these are something that all our athletes need to be exposed to. So Ibrahim and I need to communicate what's involved and see if that fits within his rehab planning. Ball work is something that needs to be included in every session. As the strength and conditioning coach in football, I'm actually a part of the coaching staff. So I need to be across the technical, tactical and physical aspects. And a lot of my day-to-day work is about linking that together. Another really big challenge of the rehab is not only the return to play component, but to do so and integrate with the focus of the squad to fit in with where we're at in our loading strategy. It can be chaotic, as you can see on the screen here. There's so many different components to what we look at, but we're really thorough in our planning, our preparation, and the diverse way in which we monitor our athletes. We have two charts here. The top chart is during rehab, and the second one is when the athlete's been asked to return to full training. There's two things that we need to consider here. Number one is that you'll see some of the absolute loads in rehab are actually higher than during his return. And this is perfect because it makes the transition to training easier. And we really try and leave no stone unturned when it comes to our loading strategies. But secondly, is if our training load continues to be lower, this athlete's going to need to do more sessions just to prevent deconditioning. He's done so much work, it would be a real shame for it to go to waste. I'm sure a lot of you in the sporting space have experienced this where all the rehab's done and the player's actually not chosen to play. This next graph is a really great example of understanding training load again. I've taken away the player names on this one, but basically you have each row is a different player and each column is a comparison of each metric that we might look at over the same time frame. And as you can see, they're all pretty similar. The difference is that one of these athletes is still a while away from unrestricted training. So we're actually able to provide a training stimulus around the constraints of the pathology while introducing some early loading strategies, ultimately developing chronic load. And Ibrahim will show you the ins and outs of that a little bit later on. We know across the board at the club that we want fit, fast, efficient athletes and for them to be as resilient as possible. So we have an athletic development philosophy from the academy all the way through to our A-League squad across different positions. There's things that we need to consider here to make athletes fit within our philosophies. And sometimes we need to think outside of the box. And a couple of the ACL case studies that Ibrahim will talk about are going to involve getting these guys to become better at moving and more efficient. One of those athletes might need to put on more muscle and the other one might need to lose some body fat to fit in with our expectations of the physical standards at Sydney FC. I'll show a couple of basic examples from, I guess, an S&C perspective before I hand over to Ibrahim for some more of the practical side of these case studies. This graph here is from our pre-season. It's a couple of seasons ago. Each green dot represents a different player. And what you'll notice is that the athlete that we'll speak about today, well, one of these athletes is actually our weakest. So we have a really fast but really weak athlete, never really taught how to move properly or control his body, naturally athletic. And Ibrahim will talk a little bit more about his injury and what we had to do to modify that. This is a pre-season T-test. Apologies, it is filmed on a phone, and FIFA have data on this T-test linking it to ACL risk. And what we get from this test is numbers, but we're actually not getting how he does it. If you have a look at every turn, he actually slips on each one, doesn't really get low. Ibrahim has a great video at the end of his presentation on what his change of direction looks like and how we had to train it. In comparison, we have one of our senior athletes, similar player. I'm not going to say that this is particularly explosive, but what you're going to notice is how much tighter he is through the turns, gets down low, drives out, changes his center of mass, small steps coming into the turns, makes him a much more efficient mover. and decreases, in our opinion, his likelihood of injury. Whether you're in teams, institutes, or clinics, these, I guess, handful of key messages are something that I think apply across the board. Get to know your athletes, understand the internal and external stresses and the role that that plays in their rehab. Some of them worry about contracts, some of them worried about having a kid, some of them are just young and inexperienced. Expose them to the right amount of load, make them uncomfortable. Have a really good understanding of what they're being asked to do. Being sport specific is not about mimicking movements only. And finally, ask questions, ask for help, work with others. I feel like we get better outcomes when we do that. I know that was a really brief snapshot, but I'll pass things over to Ibrahim for a more detailed look at his rehab philosophy. My best point of contact is just via email. So if you've got any questions, feel free to flick them across. Cheers.
Firstly, I just want to say thank you to Aidan and the Pacey Performance team. I listen to the podcast regularly on my way to work, and I'm honoured to be speaking here today. And just following on from Chris, I'll be speaking about the integrated return to performance process with our A-League footballers, and I'll go through 2 ACL case studies in an area that I'm really passionate about. So just a brief overview of the talk today. I'll go through the integrated approach and my role, my rehab philosophy, principles and process, individualisation, energy systems and criteria-based progressions, and finish with some more detailed ACL case studies to hopefully tie it all together. I'm really grateful to work with some very talented people and practitioners at Sydney FC every day in an awesome culture. I really value the input of all of my colleagues, and as Chris mentioned earlier, we're all really open-minded people and often collaborate. But one example of this is how Chris and I head to a cafe at least every second Wednesday to eat some delicious acai. It allows for myself or Chris to host a mini in-service to discuss some performance-related topics, and has definitely influenced my rehab approach and my protocols, which will be a big theme of today's talk. In my role as head physiotherapist, I obviously diagnose, treat and manage day-to-day injuries, but I also coordinate the long-term rehab programs on the pitch. I feel my background, having played football at a semi-pro level, really helps me in this role, and being able to perform the whole session with the players helps me gauge session difficulty, develop better drills, and most importantly for me, provide the boys with immediate feedback on their movement quality at the time. As clinical physios, I personally think we understand pathology and tissue capacity really well, but as a full-time physio in pro sport, I recognised early on that it was really important to have a performance focus on the athlete as a whole, and not just on the injured tissue, and that surgeon protocols are far too inadequate. So working closely with Chris, but also Alex, Elias, and our awesome team, Dr. James, who isn't in that photo there, I try to avoid that protectionist approach and instead focus on what our athletes can actually do. This is a busy slide, but all it's showing is essentially 9 out of the 50 or so in-services that myself, Chris, or our interns have created over the past few seasons. These areas include training athletes across the force velocity curve, understanding energy systems, which I'll go into further later, velocity-based training, intensive versus extensive drills, Olympic lifting, periodization, as well as many others. These topics have helped me become more of a generalist, and I believe have had a big impact on my rehab approach. I'll just touch on my own rehab philosophy briefly. To maximize overall performance whilst minimizing the risk of re-injury or new injuries. To work unaffected areas from day one and keep RPE high. To create robust footballers that leave rehab better than they were before their injury. Having a multidisciplinary approach. Individualizing rehab to the athlete in front of me, as I believe no 2 injuries are ever the same. And to be movement quality focused. And to look at the how, being the movement quality, stride length, frequency, contact time, etc., and not just the what, being the GPS metrics and data. So with regards to my principles of rehab, I like to start with the end in mind, understand the coach's physical, technical, and tactical requirements, load as early and often as possible, to understand when to progress and regress my rehab as clinically indicated. And as Chris mentioned earlier, remember that rehab is never very linear. And whilst we respect the acute to chronic workload ratios and our dashboard, I always use appropriate windows to overload tissue and allow recovery, even if it means we flag on certain metrics. And Clarky, who's an S&C coach I worked with previously, had a big influence on my view of this. To develop and follow criteria-based progressions, where pitch clearance is underpinned by strength and physical capacities. Athletes need to tick the boxes and earn the right to return, and you'll see an example of my criteria to return to full training post-ACL injury in the next slide. And finally, to ensure that tasks are challenging, as we believe athletes should be failing at times to ensure skill retention. So here's my criteria for determining return to full contact training with our boys at Sydney FC. And you can see the outcome measure, assessment type, method, and the results required to progress. It's multifaceted and attempts to cover several different capacities and areas. I will say though, injuries at our club are very context dependent. And if, for example, one of our injured boys are required to play in a grand final, ultimately it's a head coach Bimby's call to make with the athlete's consent. And it's my role to provide my objective opinion on my findings, but respect the shared decision-making process. So briefly, in terms of my rehab system, it's to understand movement competencies, how the player got injured, and what their end goal is. Develop and follow criteria-based progressions that are different and unique for each injury. To devise a plan that will continually change. Have constant communication with the athlete and coaching staff, and have an on-pitch rehab system where my structure follows the predictive, reactive, perturbated, and clearance testing path. So ultimately, I'm trying to bridge the gap between injury and performance as quickly and safely as possible, whilst also improving performance along the way. And the Control to Chaos paper by Matt Taberner was really good, and the title was also really catchy, but I think the concept of going from early control to late stage chaos has been used in rehab for a really long time and allows for optimal adaptations and obviously minimal risk as well. And the continued process of assessing injured tissue, demands of the sport and the athlete in front of me, planning rigorously and regularly, intervening whether it's pitch-based or gym-based interventions, and evaluating the outcome of my interventions. With individualization, I think it's really important to assess and improve the athlete's individual capacities in front of you. Look at their mechanism of injury. How did they fail and get injured in the first place? And then target drill selection and focus on this in end-stage rehab. And look at the entire kinetic chain, meaning we look for weaknesses and compensatory patterns, particularly those at the hip. And in my experience, weak glutes affect knee function significantly, and an anterior ankle impingement, for example, can increase soleus tone. Respect the psychosocial factors. Understand that building trust and relationships with the boys is key. To try and learn about what motivates and stresses them, explaining why tasks they're asked to do are really important for them, and then try to gauge whether they're athletes that may need to be pushed a little bit, or if they're overconfident and careless, may need to be held back slightly as well. Know their playing position and start with this in mind, and also ensure that our end stage drills focus on their position in a match. Our A-League is also quite unique in the sense that we have quite a small pool of players, and it's quite difficult to replace those that are injured. Our league's also quite transitional and physical. So we need to ensure that players can return to that style and level as soon as possible, but also allow them to deload before coming back to full training. And you'll see a few examples of this in later load graphs. With energy systems and conditioning, there's some really good evidence that shows that if all three systems are not fully restored during rehab, and an athlete hits the wall when they return, that their skill base decreases, which can increase their risk of re-injury. We know that by manipulating drill speed, power, and output, and work to rest ratios, we can target all three systems. And I think a lot of physios, and I know I've been guilty of this earlier in my career, fall into the trap of prescribing the 1 minute work to 1 minute rest type drills, which have a massive aerobic focus and actually create slower athletes. We also know that because of injured tissue early in rehab, it's much harder to achieve higher intensity actions, but it's very important we shift to this focus later on. And from my experience, after rehabbing my first ACL at Sydney FC 4 years ago, I know I learned a lot. And even though my athlete Ryan was selected into the national team not long after, has been performing really well with no issues since, I was able to gain some really valuable insights. And apart from learning that decelerating maximally was challenging for him when returning, and that he preferred skill-based conditioning rather than isolated running, the biggest aspect I took away, and probably only fully understood more recently working with Chris, was that I didn't focus enough on the higher intensity anaerobic and repeat sprintability type conditioning with Ryan. So here you can see a video of Ben Warland at 3 weeks post ACL reconstruction, when running's obviously contraindicated due to his ACL injury, forming some rope circuits just to try and maintain that aerobic capacity and VO2 focused conditioning. And as early as possible with all injuries, I try to use ropes, upper body conditioning circuits, or F30 circuits as we call them, the rower with the injured foot on a slide board, the bike, the ski erg, and whatever else I can, just to try and maintain VO2 max and aerobic capacity as soon as possible. So basically, when creating rehab drills, it's important to work backwards from the end goal and to look at training and match demands for the individual athlete and their specific playing position as well. Here's a really good study by Gary Walker that shows the positional match demands of players in the EPL. And for example, a centre back who may require more lateral movement, less high-speed running, and more defensive drills when compared to an attacker whose rehab should involve sharper turns, higher speed running, and finishing drills, especially towards the end stages of their rehab. We go through an example of rehabbing a defender versus an attacker at Sydney FC post ACL injury and the individualisation process a little bit later on, which brings me to my drill profiling database. Basically, I've created a drill database or a rehab drill planner, which use GPS metrics to quantify each drill to help standardize my rehab. I layer energy systems, positional, and tactical components to these drills, and players are progressed from starting with predictive and controlled drills all the way through to clearance and chaotic drills at the end of their rehab. All drills are named, analyzed for their metrics, and are stored on our dashboard, as you can see in the image. Here's a video of my drill database library, which covers several different categories of football rehab, including dribbling, attacking, defending, contact progressions, decelerating, and so on. This particular video shows examples of dribbling drills in the early, mid, and later stages of rehab. Basically, all early rehab usually has an aerobic capacity type focus, with drills such as a 4x4 minute non-contact dribbling circuit with 2 minutes of rest. As tissue healing occurs, and we can build into harder intensity drills, we build into an aerobic power and MAS type focus. This is then followed by repeat sprintability and an anaerobic capacity and power focus, which may include, for example, contact drills in an open environment in even harder intensities. Finally, at the end stages of rehab, we incorporate speed power, which involves max intensity actions and drills that involve perturbations under pressure and under fatigue. During these end stage rehab sessions, I feel it's really important to have a coach involved to watch the athletes perform their drills and provide them with appropriate feedback. The same applies to my rehab exercise selection process. I've spent the last few seasons creating an objective and categorized exercise library with 60 or so progressions for each. Understanding principles of progressive overload, force generating capacity, rate of force development, and by training our athletes across the force velocity curve while in rehab, working closely with Chris, my colleague Henry and I have been able to create an exercise rehab library so players can stay motivated with new exercises, but also make adaptations every week. This video shows a few examples of mid and later stage quadriceps and hamstring exercises from our library. We look to add exercise difficulty by increasing load, having a unilateral focus, and by increasing rate of force development only after we have improved force generating capacity with our boys. As we know, the anterior cruciate ligament is composed of two bands, the anteromedial bundle toward inflection and the posterolateral bundle taught in full knee extension. ACL injuries occur in approximately 40 milliseconds, while it takes over 500 milliseconds for us to appreciate the rupture has actually occurred. This brings us to our two ACL case studies. We have Trent on the left, who's an attacker and suffered a right ACL rupture in October 2018, and Ben on the right, who's a central defender and suffered a left ACL rupture in March 2019, approximately 5 months after Trent. I'd like to acknowledge that both players have given us full permission to show the following data and injury footage, and thank Alex, Matt, and Justin for helping me put together some of these videos and graphs. So before we go through Trent's ACL injury footage and his rehab program, I'd like to show you some footage of Trent before injuring his ACL. This is a healthy Trent in the preseason, performing a drop landing test 6 weeks before his ACL injury. We are looking at his pelvis, trunk rotation, hip adduction, knee valgus moment, and other compensatory strategies in this video. We assess all of our players for ACL risk using several tests in preseason, and this test is scored using our modified landing error scoring system. Here is Trent performing another ACL screening test in our preseason, the medial single leg hop test on a jump mat. Here we assess for contact time and movement analysis, and the cue is to hop as fast as you can while keeping hands on your hips. It was clear to us at this stage that Trent was a poor mover and was potentially a higher ACL risk athlete. And unfortunately, we didn't have enough time to improve his athletic capacities to prevent his ACL injury that occurred approximately 6 weeks after this video was taken. You will see footage of his injury in the next slide. This is Trent's ACL injury footage during a preseason trial game where his right foot is fixed on the ground and he suffers what you would classify as a non-contact deceleration mechanism of injury. And here is Ben's ACL injury footage. As a centre back, Ben has gone up for an attacking corner during a match, had a very minor contact moment with an opposition player on a very wet pitch as his left foot remains fixed and he ruptures his left ACL. When looking at mechanism of injury research, this study highlights that after assessing ACL injuries over 10 seasons, from 2001 to 2011, in professional male footballers in Sweden and Norway, of the 39 complete ACL tears, 11 of them occurred during the pressing action, and that 85% resulted from non-contact or indirect contact mechanisms of injury, which was the case in both injuries we just watched. This slide highlights the 4 stages of rehab that our athletes progress through. And essentially all it's showing is that early on, we have a very strong clinical focus. And I believe that maintaining knee joint homeostasis in the form of continually assessing for range, pain, swelling, and function is crucial throughout the entire rehab process. I also think that manual therapy, assessing for muscle tone, knee joint mobs, and so on, are crucial throughout the entire rehab process and are often seen as bad or taboo words these days. And that as we progress from clinical to gym-based to field-based to performance-based rehab, we focus more on movement efficiency rather than correction. And our on-pitch rehab should expose the athlete to progressively harder variables across the 4 pillars of physical, technical, tactical, and cognitive. And I've highlighted conditioning in orange to highlight the importance of focusing on this throughout the entire rehab process. So what to do from here? We're day 1 post-ACL injury. I need to assess all of Trent's athletic capacities, discover his weaknesses and his strengths. And as Chris mentioned earlier, he was a very weak athlete, had a short training history, was very young, and had a non-contact ACL mechanism of injury while decelerating. So it was important that I individualize his plan. In my opinion, his priorities were his motor control, hypertrophy, running mechanics and movement quality, aerobic and anaerobic conditioning, change of direction ability, deceleration ability, and decision-making ability. So there was a lot of work to be done. So as for our centre back, Ben, his main areas of improvement were his rate of force development and power, his stiffness, movement quality, repeat sprint ability and speed power systems, contact exposure, which was his mechanism of injury, and his overall confidence. Which brings us to planning. So with regards to planning, I like to quote, "Plans are of little importance, but the process of planning is essential." I need to decide what I want end stage rehab to look like for that individual athlete, and then begin with the end in mind and work backwards from there. I plan all of our predicted variables, milestones, goals, and then set dates to achieve certain criteria. And after having a very messy desk, like in that photo there, I come to a final plan on Excel that will be regularly modified through the process of assess, plan, intervene, and reassess. So looking at the measurable data and loads now, let's fast forward to 6 months into Trent's ACL rehab. And as Chris mentioned earlier, if we look at Trent's RPE, total distance, number of sprints, high speed and very high speed running meters, we can see that Trent's total work in rehab with me has been significantly higher than that of the team. And this is at 6 months post-op before his return to team training. So now looking at Ben's measurable data at the same 6 month post-op mark, you can see the graph represents Ben's total distance, number of accels and number of decels. And that red line represents the 7 month mark post ACL injury and his return to full team training in November. At this stage, Ben has passed the return to training criteria that I showed earlier. And after starting running in July and building up to the 6 month mark in October, we can see that Ben's total distance, accels and decels are higher than the team average. For me, it's really important I've overexposed Ben to these metrics before returning to team training to reduce his injury risk, but also to ensure performance. As Chris mentioned earlier though, it's also our job to make sure he's topped up with extra high-speed running sessions and higher RPE sessions to avoid detraining and losing the gains he's made during his rehab. In my opinion, it's the things that we can't measure that are just as, if not more important than the measurable loads in determining successful rehab. These areas include cognitive, contact progressions, multi-plane decelerations, slide tackling, kicking load, and player confidence. I also think it's really important to expose players to drills with the team as early as possible, as a bouncer on the ends of drills initially, in the center of drills, and then in a pink non-contact bib as they progress through their rehab. I feel this eases them back into training, decision-making ability, and full training as safely as possible. Now, just to go through a snapshot of some of our early stage fundamental drills on the pitch. In the early stages of rehab, there isn't too much opportunity for individualization. Our aim here is to teach movement basics, such as landing softly, to reintroduce running, and as said in the first video here, teach principles such as the 1 meter radius principle, where the player shouldn't lunge wider than that area during his or her rehab. You can see Ben here being really smart and cautious not to lunge past that safe radius. The principles here are to reduce injury and risk of re-injury early on. I also think it's really important to provide regular feedback. I use K-tape over the medial part of the knee to provide sensory feedback during poor movements. And we also introduce change of direction in these early phases. During this mid-stage rehab, we can actually start to individualize drills to target athletic capacities and position-specific requirements. In this top video, you can see Ben performing some center defender-specific movements as we target his anaerobic capacity using a 40-second higher intensity effort and a work-to-rest ratio of 1:4. Personally, from my experience, adding a ball in nice and early and disguising conditioning with ball work tends to improve motivation, as the most of my rehab boys hate isolated running. And also, if you can create some sort of competition or challenge, that motivates them even more. So here in our mid to late stage rehab, we continue to push the boys. You can see Ben working on some slide tackling, defending from a press, and landing mechanics with perturbations. It's obviously very important at this period to target Ben's mechanism of injury, which was contact, and try to work on his competencies and capacities we recognize as weaknesses earlier on. With regards to energy systems, we aim to target the anaerobic power and max intensity type drills in this phase, with work to rest ratios of 1 to 5 to try to ensure full recovery and to maintain explosive outputs. Here are a few examples of some strength and power exercises that will prescribe to Ben this mid to late stage using the exercise rehab library. With end stage rehab, we promote stiffness rather than softness with our landing drills. And if you look at the video on the top left, you can see how much Trent's movement quality and efficiency has improved when compared to his cutting task that Chris showed earlier, now that he's at the 6-month post-op mark. Our end stage rehab should be very position specific, should tie all 3 energy systems together. In the video on the bottom left side, you can see Robbie, one of our coaches, having an input on a finishing drill with Trent at the 6-month mark. I also recommend round studs rather than blades or metal studs during our ACL rehab, and avoid artificial surfaces based on the really good shoe to surface traction study by Athol Thompson. Now to tie everything up, let's have a look at some footage of the boys back in full contact training with the team at the 7-month mark. You can see Ben here in the yellow circle going into a 50-50 contact challenge with an opposition player, looking very comfortable and confident. And here we see an example of Trent maximally pressing or decelerating, which was his original mechanism of injury, but looking very comfortable and safe doing this with the team. And just one example of an end stage test. Here's a video of Ben performing some isokinetic King Kong testing. And the page on the left is Trent's injured versus uninjured quad versus hammy strength data at 60 degrees per second, which is the slowest speed on the King Kong and typically highlights the biggest differences. And you can see he has a 0 and 0.1% difference, which was incredible to see. And that his quad to hammy ratio was almost exactly 60%, which was our rehab goal. And finally, just some footage of Trent after returning from his ACL injury in an Asian Champions League match. I really enjoyed watching this goal and was really proud that all of his hard work paid off for him. Thank you. If anybody has any questions or would like to get in touch with Chris or myself, please shoot us an email